So, today we're starting the first of a series of interviews that I'm going to be hosting on topics such as infertility and hormonal imbalance. So today I'm speaking with Dr Haider Najjar on the topic of IVF. Now, Dr Najjar is a specialist gynaecologist, obstetrician, he's a fertility specialist with Melbourne IVF. He's an advanced laparoscopic surgeon and a robotic surgeon. Have I forgotten anything there?
No, Kathy, you haven't. It's a very generous, very lovely of you to, yeah, thank you.
Well, first I'd like to welcome you here and thank you very much for making time in your busy schedule. I know from working with you for very many years that you're an extremely busy man. So would you like to start with just telling us a little bit about yourself?
Yeah, no, it's a pleasure, Kathy. It's delightful to work with you, and you know, you and I worked in the health sector for a long time, and I'd love to be involved with what you're doing now. It's fantastic, and I'm very excited to be part of it. Yeah, no, I think your introduction, Kathy, was great, and that tells all about what I do. I teach in Monash University, teach doctors in training in fertility and fertility surgery, and but I'm also a fertility specialist in Melbourne IVF, as you said, and I look after women during the pregnancy and childbirth as well. So yeah.
Okay, so let's get on and launch into the topic. What is IVF?
So IVF stands for in vitro fertilization. It's one method of assisted reproductive technologies that can help couples or women with infertility. It provides a fertility option. What it involves, basically, it refers to the process of fertilizing the egg with the sperm outside the female body. That's what IVF stands for. Yes.
Okay. So when would you generally recommend IVF to patients?
Yeah. So IVF can be a great solution for couples who suffer infertility. 1 in 6 couples may have difficulty falling pregnant, and that could be due to male causes or female causes. 30 to 40% of couples we look after have male factor of infertility, and I just want to use this opportunity to put it out there. That's really important for the men also to be involved in the process, and we can cover that later or on another occasion. So male factors, IVF can be useful. Of course, there are lots of other fertility treatments. A lot of the couples we look after may not or will not need IVF. Mm-hmm. And you know, we usually try other things before we try IVF, but sometimes IVF is necessary. And sometimes for female factors, if their tubes are blocked, for example, where the sperms can't reach the eggs to fertilize them, there are other conditions where there's endometriosis, for example, or sometimes even unexplained infertility. Mm-hmm. IVF can also be an option for single women or same sex relationships as well. So it can provide a really good solution for a lot of people.
Definitely, definitely. So what recommendations do you generally make prior to commencing it?
So prior to commencing IVF, or generally all couples that we look after, they seek help with fertility, we would like them to optimize their health and improve general fitness. And you know, so for example, if the male or female, you know, they overweight, would like them to have to normalize their weight and be fit, not just to improve their ability to conceive, but also for women to be able to have a healthy pregnancy and give birth in a healthy way, and also to look after their newborn afterwards. So it's very, very important for couples, women and or men involved in the process to try to be at their healthiest, at their fittest prior to commencing a fertility treatment.
Definitely, definitely. So what's your general course of treatment? What could someone expect to go through if they've decided to go onto IVF?
So if IVF is deemed to be necessary, so basically they would have been seen by a fertility specialist like myself, and we would explain to them the process and what it involves, and then there will be an administrative part that would involve in Victoria in particular. They need to do police checks, and they go through counseling. They meet with the nurses that explain to them how to administer the medications, and this process takes a few weeks. And once that is done, then the patients can commence the treatment. The treatment's usually daily injections. They're tiny little needles like the diabetes pen, and it varies. It depends on the condition. There are different ways we administer the medications and what different types of medications. I don't want to bore you with those details. But usually it's around 10 to 12 days on average of actual treatment before we can do the egg pickup procedure or harvesting the eggs. And this procedure is done under a twilight anesthetic. I know that you're very familiar with the procedure, Kathy. Being
as a nurse, not a patient, Haider.
Exactly. As I said, being a health professional, and you've yourself participated in it many times. So it's a brief procedure that probably around 20 minutes in total. A twilight anesthetic like people need if they do a gastroscopy or colonoscopy, and we use an internal ultrasound to guide us to the ovaries, and then we aspirate the fluid from the follicles that usually contain the eggs. Patients would go home after a short hospital stay, probably around an hour or so after the procedure. And we fertilize the eggs with the sperms. There are different ways of fertilization in the lab. And then usually 5 days later, patients come back for the embryo transfer. And this procedure is done, it's like a pap smear. I know it's easy for a bloke to say that, but it doesn't usually require anesthetic. And we put the embryo inside the womb and hope for the best after that.
So what's the likelihood of successful pregnancy following the treatment?
That's a very good question, following the last one. Okay, so that is in a significant way dependent on the age of the female. Okay, so the younger the female is, the higher the chances are of achieving a pregnancy. Okay, and not just achieving pregnancy, but also having a healthy pregnancy going forward. So when women are under the age of 40, the chances of achieving pregnancy from one stimulated cycle, when I say stimulated cycle, is the cycle where we get the eggs out, and because usually we have, more than one embryo. Any more embryos we put in the freezer. So the chances of achieving pregnancy from that stimulated cycle is probably around 50%, almost 1 in 2 couples, when the women under the age of 40 would be able to achieve a pregnancy from one cycle, from one stimulated cycle. Those embryos, the blastocysts, and we have really advanced techniques now in choosing the embryos, and the success rate has improved significantly of late.
Definitely.
Each embryo has almost 1 in 3 chance in achieving a pregnancy. As women get older, the chances of achieving pregnancy drop. When you get to, especially over 43, 44, 45, then the chances will be really slim. When you get to 46, the chances will be probably around less than 1%. That's why most IVF units do not perform IVF on women who are older than 46. Some do 47, but they can, if they want to do IVF using a donor egg, of course, until the age of 50 after that.
Okay.
I hope I'm not boring you with too much details.
No, that's good. No, that's what people want to know, isn't it? So, Okay, so you've already touched a little bit on diet and lifestyle and weight, but they're obviously extremely important factors for the overall health of the male and the female in this whole process.
Absolutely. You know, I can't overemphasize the importance of being healthy and fit. Firstly, when, you know, I think, put IVF aside, the majority of couples, if they lead a healthy lifestyle, they may not need help achieving pregnancy in the first place. Okay, and a lot of them, when we see them, and if there is an issue with weight or lifestyle changes, by the time they change their lifestyle, they may not need any help. So firstly, by improving your health and level of fitness, you may eliminate the need for help, or if you still need help, you will need less help, if that makes any sense.
Sure.
Okay, so it's really important to do that.
Yeah. So what recommendations would you make to couples facing infertility? I know from conversations we've had over the time that, you know, women waiting before they come to see you. So like, at what point, if they're not conceiving, should they come talk to you?
Yeah, so that also depends on their general health and in particular their fertility health. So, and it's all, fertility is heavily, you know, dependent on age. And when, in general, as a rule of thumb, if women are, but until the age of 35, if they have regular cycles, that mean that having regular cycles, that mean they are ovulating. Okay, they are releasing eggs regularly. That's the biggest indication for it. If you under the age of 35 and you have regular cycles and you don't have any significant pain or indication of or heavy periods or any indication of a problem, then they should try for 12 months before they seek help. And of course, if there's no indication of a male issue as well. If women over the age of 35, then and they have regular normal cycles, they should try for 6 months before they seek help. Of course, if there is any indication of excessive pain with periods or sexual intercourse or heavy periods or irregular periods, then you will need to seek help immediately and not wait.
That's really great advice. Thank you for that. So just talking about freezing, and something we might touch on a little bit is about egg freezing. So what about for those women out there that don't have a partner? So they may, at what point would you perhaps be suggesting women maybe freeze eggs for down the track?
Kathy, to put it really bluntly, the main hurdle for egg freezing is cost. Okay, if egg freezing was free, then I would recommend the majority of young women to consider freezing their eggs. You have to remember that our lifestyle has changed in the last few decades. You know, in the past, I don't necessarily condone that, but women didn't used to have jobs and they used to have babies in their early 20s and even from their late teens. Okay, things have changed now. Women are all career driven and people go on holidays and this and that and mortgages, and so we put babies on hold until we've completed everything, and you will never complete your mission in life. There is always something to do. There's always a better job, a better house, or a nicer holiday. So please remember that fertility doesn't wait. There is a time frame, and we recommend now even to women in their 20s to consider to freeze their eggs. So by the time you get to 32, the fertility starts declining gradually, and when you get to 35, the fertility starts declining quite steeply. So you at your best fertility in your 20s and very early 30s. Okay. So that's really the time to consider egg freezing. It's if you want to do it after, that's fine, but the best time is when the eggs are at their best. Okay. And speaking of the cost, now the majority of the IVF units now and trying to make it easier. And there are, in Melbourne IVF, for example, we have a package where they'll actually reduce the cost for egg freezing, and there's payment plans where things actually aren't as cumbersome and expensive as they used to be.
I mean, I know there is a lot of these cheaper places popping up around the place, but they don't offer all the things that
look, the cheaper places, you know, they provide a solution for, you know, for IVF, low cost IVF. It's a model, but they don't have for low cost IVF. There's no egg freezing or options for single women or same sex couples or complicated cases. There's straightforward, you know, cases, but anything that requires technology, freezing, that's not available in these.
Okay. So is there anything else you'd like to add before we finish?
No, I think the two main messages, you know, that if we can conclude our discussion today are two, really. First one is the importance of lifestyle and being fit, diet and exercise, and how really important that is for people and their fertility. And the other important message that I would like people to remember is the impact of age on fertility. So the fittest you are, the younger you are, is the better to deal with fertility then.
Right, excellent. Well, again, I'd really love to thank you for making yourself available to us today. I know how busy you are, and I know you've probably got patients waiting out in that waiting room.
No, I actually finished, Gary. It's been a pleasure to actually be part of this amazing thing that you're doing, and I would love to pop up every once in a while to help out with you know, addressing certain medical issues that you deal with. But it's been always lovely working with you, Kathy, and I would love this to continue in this form as well.
That'd be amazing. So if anyone's wanting more information about Melbourne IVF or Dr Najjar, then I'll be putting links up with the video so that you can get in contact either directly with his rooms or with Melbourne IVF if you'd like more information. So wonderful. Thank you so much.
Thank you, Kathy. All the best.
All right. Bye.
All the best. Bye-bye. Bye.